ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಕೊಳ್ಳೋಣ.
ಸ್ಟಾರ್ಟ್ ಮಾಡಲ ಸರ್?
ಪೂಜಾ
ಸ್ಟಾರ್ಟ್ ಮಾಡಲ ಸರ್?
ಹೂನಮ್ಮ.
So, a very pleasant evening, everyone. I warmly welcome you all to this virtual gathering. It's a matter of pride that we are discussing the important topics of Ayurveda in the online mode and to honor the timeless wisdom of Ayurveda. This program is organized by Vishwa Ayurveda Parishad. On behalf of this organization, I extend a heartfelt welcome to our speaker, Dr. Shankar Prasad sir, and I extend a heartful welcome to our respected dignitaries, Dr. Anand Katti sir, Dr. Mohan Joshi sir, Dr. Nikita Sharma ma'am, Dr. Devendra Singh Chaha sir, Dr. Rohit Ranjan sir, Dr. Umang Pandya sir, Dr. Sangeeta Mishra ma'am, Dr. K. Venkat Shivanda sir, Dr. Bharat Chaurakade sir, Dr. Arvind Kumar Gupta sir, Professor Yogesh Chandra Mishra sir, Professor Mahesh Vyas sir, Surendra Chaudhary sir, Professor Anil Shukla sir, and also I extend a heartfelt welcome to all the faculty members and all the participants who have joined with us on this Google Meet. The theme of today's guest lecture is Concept and Applied Aspects of Vrana pareeksha in Sushruta Samhita. As we all know, Acharya Sushruta is the father of surgery and Vrana is one of the prime topics he elaborated. We are indeed fortunate to have with us Dr. Shankar Prasad K sir as our today's guest speaker. Prayer is that gentle breath which connects our heart with the positivity, peace, devotion. I would like to invite my friend Vasundhara. Sir, access ಕೊಟ್ಟಿದ್ದೀರಾ?
ಅಲ್ಲ, there is no request. ಅವ್ರದ್ದು ID ಏನು?
ವಸುಂಧರಾ ಅಂತ ಇದೆ ಸರ್.
ಬಂದಿಲ್ವೇನಮ್ಮ?
ಜಾಯಿನ್ ಆಗಿದೀವಿ ಅಂತ ಹೇಳಿದ ಸರ್.
ಹಾ,
ಇದೆ ಸರ್.
ಬಿ ಅಲ್ವಾ? Vasundhara, you can unmute and do the prayer.
Hari Om. Ya kundendu tushar dhabala, ya shubhravastra ya veena varadanda mandipakara, ya shveta padmasana, या ब्रह्माच्युत शंकर प्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापः
Thank you, Vasundhara. To opening remark the program, I request Dr. Anand Katti sir, Professor, Head of the Department of Samhita Adhyayana, GMC Bangalore.
Thank you, Pooja. Good evening, all respected dignitaries, dear participants, and my dear students. As you are aware, Vishwa Ayurveda Parishad Samhita Sambhasha organizes a lecture on every 21st of month. So on this event, we have today a session on Vrana, particularly with insights from Sushruta Samhita. So And we have Dr. Shankar Prasad, who will be doing a deliberation. Now, as far as the topic is concerned, Vrana is one of the very common entity that we find in clinical practice. We know that a small injury, small cut can be Vrana, and it can be to such an extent that we will see non-healing ulcers, ulcers that may take away the life also. So such is the gravity of the Vrana, and Vrana, which is a part of a general practice, also a part of specialty practice. We have wound care clinics, we have wound care OPDs, whereas in general practice also a common incidents, accidents, etc. can bring the patient with the Vrana. And such an important topic, which is useful not just for any specialty practitioners, but for general practitioners also, is Vrana, which will be discussed today. And as far as Sushruta Samhita is concerned, we know the fact that the definition of Vrana comes as Vrinoti Gatravichvaranane, which was much, much before anyone could come and comprehend that the ulcers are called as a break in the continuity of the tissue. The exact translation of which was presented in our own Samhitas. Sushruta, who learned the Vrana in all possible dimensions, who learned and explained the Vrana from all possible dimensions. When I say all possible dimensions, what do I mean? We mean there can be Nijavrana, there can be Agantuvrana, and the Nijavrana, Agantuvrana both can be seen having the involvement of the dosha, and therefore we can talk about doshi classification of Vrana. We can talk about the Shuddha Vrana, we can talk about the Dushta Vrana. We will talk about Dushta Vrana more with more importance, because that's where the infected wounds are coming, and which are going to be a challenge as far as offering the care is concerned. And Vrana can be seen occurring in any part of the body, and therefore the general line of treatment will be coming. But there are certain part of the body where the Vranas are there, then you require to give more attention. For example, an ulcer in eye is different dimension, have to be looked into with a different dimension. At the same time, we will learn something called as Nadi Vrana, which is also has to be looked into with the different dimensions. So therefore, Vrana is one of the very common topic, but one of the very commonly faced conditions in clinical practice. And therefore, whenever we say common, they need to be learned repeatedly. One has to remember. You cannot, there is no scope for you to ignore or forget any of the concepts related to Vrana when it comes to practice. And therefore, these sessions, these discussions on common topics also need to be conducted on a periodic basis. So with this purpose, to throw the light on this topic, particularly from the Sushruta's perspective, we have joined here. And that is not Vrana is, again, we have different types of management when it comes to Vrana. We go for dhupa, we go for grita use, we even go for shodhana, shamana, etc. And therefore, one of the, I mean, particularly the non-healing ulcers, many of the patients who have tried everything will come towards Ayurveda, and therefore that is also one of the area where we can excel in our clinical practice. With this brief note, I thank the organizers, and I thank the Vishwa Ayurveda Parishad itself for providing me a platform. And I close my opening remark and pave the way for the session. Over to you, Pooja.
Thank you, sir. So, our guest speaker, Dr. Shankar Prasad K, sir, Associate Professor, Department of Shalya Tantra, Alvas Ayurveda Medical College, Moodbidre, Karnataka. I request sir to carry over the session.
Thank you. Thank you for the opportunity. I thank Dr. Anand Katti sir for this opportunity for presenting me in front of all of you. I hope most of the students are there. So let me start my presentation. Yes, is it visible? The whole
Yes.
screen is visible?
Yes,
Yes,
it's
sir.
visible.
Yes. So actually, when I prepared the presentation, it was more of the practical aspect. But when we are discussing about the Samhita from Sushruta Samhita, especially if you consider the Vrana concept, the most of the Vrana concept, the entirely if you want to study, you have to study Sushruta Samhita. So we will be talking at least few information which has dealt especially from the Sushruta Samhita itself. So the topic is concept and the applied aspect of the Vrana. So most of the students, as you are here, so I want to tell some applied aspect how you can take those messages in your clinical practice also. So let us take the blessing of the Dhanvantari, who is the god of the surgery. Satata adhyayanam vadaha paratantra avalokanam tadvidyacharya sevacha buddhi medha karoganaha. I am starting with this quotation because when we want to study the Samhita, as sir is a master in Samhita, so Anand Katti sir used to say that every time when we study, there should be satata adhyayana should be there, and we have to go in depth of the subject, and then discuss among us. So that's what we are doing here in all CMEs, workshops, and in this webinar also. So let us directly come to the topic of the Vrana. So this Vrana is not only told in only one chapter or one topic of the Sushruta Samhita, but it is widespread in many areas. Even in Sutrasthana, there are many topics of Vrana is told. Even in the Chikitsasthana, Nidanasthana, if you go to the Uttara Tantra, everywhere the Vrana topic is very important. So if you take the definition, what is the Vrana? Is Vranoti asmat rudeyapi Vranavastu nanashyati adeha dharanat tasmat Vrana ityachyate budhaihi. So the wise person who are telling the Vrana is nothing but it is present throughout the life. If one get the Vrana in his life, then the sign of that Vrana is present throughout his life. So Vrana Gatra Vichurnane. Gatra is the any part of the body. The same thing is told in the modern science also. If there is a breakdown or discontinuity in any part of the skin or epithelium, that is called as wound or the ulcer. Similarly, Sushruta has told Vrana Gatra Vichurnane. So that Vrana is of two types, Nija and Agantu. Okay. So this Nija is the one that is based on the different causes that is present inside the body because of the doshas. Whereas the Agantu Vrana, Aganturapi Purusha Pashu Pakshi Vyala. So those are the animal bites. Or it can be because of Patana Pidana Prahara. Maybe because of external injuries, blunt traumas, major traumas, Visha, Tikshna Ushada Shakala Kapala Shunga, Chakra. So all these are the different causes which can result in the Abhighata. So these are the some of the Sadhyavranas told in Sushruta Samhita as Chinnam Binnam Tata Viddam Shatam Pichitam Evacha Grishtamahus Tata Shashtam Tesham Makshami Lakshanam. So Acharya is telling a separate chapter on 6 types of the Sadhyavranas in the second chapter of Chikitsasthana, where here we will not be discussing about those Sadhyavranas, we will be more concentrating on the Dushtavranas and the basic concepts of the Vrana. So this Vrana, when we are talking, Shanmulo Ashtaparigrahi Pancha Lakshana Lakshitaha Shashtya Vidanahi Nirdeshte Chaturbhihi Sadhyate Vranaha. So this quotation you can by heart and write in the exam also. So it covers almost entire aspects of the Vrana, where Shanmula. So the 6 causes for the Vrana are the doshas, Vataja, Pittaja, Kafaja, Raktaja, Sannipataja and Agantuja. And Ashtaparigrahi, there are 8 sthanas of the Vrana and 5 lakshanas, the different like Akriti, Varna, Vedana, Srava. These are the different types of the Pancha Lakshanas are told. But once he is discussing about the Chikitsa, there are 60 procedures. So if you read that 60 procedures, only in Sushruta Samhita there are 60 procedures for the Vrana. Even in the modern science also, there are that much of the Chikitsas are not told. And Chaturbhihi Sadhyate Vranaha. So there should be the combination of the 4 factors for the healing of the wound. So when we search for the topic of the Vrana, I found that even in the Sutrasthana itself, in the 5th chapter, like Agroparani Adhyaya, there is the concept, just he has introduced some of the concepts of the Vrana, like the ideal a wound or the ideal qualities of the Vrana is told. And in the concepts of the Kriya Kala, he has introduced the six stages of the Vrana also. And in Agroparani Adhyaya, he is telling some Sadhya Vranas and their Lakshanas also. And in Yantra Vidhi and Shastra Vidhi, he is giving some of the example of the instrument which are used for the healing of the wound. And in Yogya Sutri Adhyaya also, there are some concepts related to this Vrana. You can find the Patyapatyas in the Hita Hiti Adhyaya, 20th chapter of Sutrasthana. And in the 21st chapter, Vrana Prashna Vidhi Adhyaya, where Kriya Kalas has been told, which is especially is giving, Acharya Sushruta is taking the example of this Vrana and then giving the 6 stages of the Vrana. And in the next chapter is very, very important for your exam also, Vrana Srava Vijnani Adhyaya, where Acharya Sushruta is explaining the major concepts related to Vrana, like the Vrana Adhisthana, Vrana Akriti, which we'll discuss here. So those are explained in Vrana Srava Vijnani Adhyaya. And if you come to the Chikitsasthana, the first chapter of Chikitsasthana is Vivrani Adhyaya. So if you see the Charaka or Vagbhata, the Chikitsasthana starts with some other topic, whereas Sushruta is giving more important to Vrana. If you just check out this list itself, I have listed only few of the chapter name, but the entire Sushruta Samhita has many aspects related to this Vrana is scattered in various topics also. So Dvivrani Adhyaya especially explains about the Chikitsa of the Vrana, and Sadhya Vrana Chikitsa Adhyaya is the next chapter, second chapter of Vrana, where he is explaining about the traumatic management. And in Dagdha Vrana and context of the Bhagna also, there are some topics related to the Vrana is present. So we'll go to the next, the Vrana Adhisthana. Tvang Mamsa Sirasnayu Asti Sandhi Koshta Marmaniti Ashtau Vrana Vastuni. So Vrana Vastu is nothing but it is the plane of the Vrana. So once there are Vranas are present, they have different planes. So there may be some of the Vranas which are superficially present. There are some of the Vranas which are deeply situated. There are some of the Vranas which are present at the Asti level. There are some of the Vranas which are at the Koshta level. So Koshta, we consider it as internal injuries. So if the Vrana is Tvakbedi Vranaha Su Upacharaha, if the Vrana is superficially present, so that can be easily handled, whereas others are difficult to handle. And in the 22nd chapter, Acharya is explaining about various Vrana Varnas for Vataja, Pittaja, Kaphaja, and Sannipataja also. So I'll give some example with picture, with some of the pictures also, then you can understand it in a better way. And here he has explained about the Vrana Akritis. Tatra ayatas chaturasro vritta triputaka iti Vrana Akriti Samasaha. So there are different shapes of the Vranas. Even in the modern also, we say some of the wounds are in circular or spherical in shape. Some of the wounds are very much elongated. Similarly, ayata is, you have to take ayata as the elongated wound. Chaturasra, it is having the border type of the wound. And Triputaka, it is triangular type. Vritta is the spherical type of the wound. So I'll come to what is the importance of these things, why we want to study all this Vrana, Akriti, Varna, etc. And in the next, he has talked about the Vrana Srava. So if it is a Vrana is present at the Tvak level, Tvak Ashrita Vrana, then it is having Salila Prakasha Srava will be there. If the Vrana is present at the Mamsa level, then Sarpi Prakasha. That is, the discharge is little bit thicker in nature, whereas and it is Sandra and Shweta and Pichila. Siragata, if the vessels are involved in a wound, then Raktati Pravritti, there will be bleeding will be present. And if it is the Snayu, the tendons are involved, the deeper structures are involved, then there will be Snigdha, Gana and Singhanaka Pratimata. Or discharge is very thick, like it is like the phlegm or the kapha, like. And if the Vrana is present in the Asti level, if the bony injuries are there, the wound or the infected type of the wounds are present at the Asti level, then there will be Shukti Dauta Sadrisha Srava will be there. Whitish flakes like discharge will be there. So that's what told in the Vrana Sravas. And Vrana Vedana, if you want to study the different type of the Vedana, see, here Acharya has told Todana, Bhedana, Tadana, Chedana. So different type of the Vataja type of the Vedanas. So you can take this concept not only for the Vrana, you can also apply it in other clinical conditions and then treat it according to that. So once we study this toda is what is that vedana, what is that chumuchumayana, so you can take the chumuchumayana concept and then apply it in the neuropathy like of the conditions. So that is the application part of this. So in nutshell, Acharya has told 5 types of the examination like Vrana Akriti, Vrana Varna, Vrana Vedana, Vrana Adhisthana, and Vrana Srava. So I'll just give one example. Are you able to see it, this picture, before treatment and after treatment?
No one can reply because they will be
Yes,
muted.
yes.
They'll be unmuted
Yes.
only at the end.
Yes, okay, sir. Fine. So this is one example. The patient had some ulceration. There is a vrana in the lower leg. So first picture depicts the before treatment, and once he is treated with some kashaya dhara and lepas, and then after few days you can observe the change in the color, and at the end there is some color change. The wound has healed, but there is the presence of the scar mark is there. So that's what I was telling. Vrunoti asmat rudeyapi vranavastu nanashyati adeha dharanat tasmat. Throughout his life, the feature that he has suffered with the wound is present in his foot. So this is one more way how we can scientifically present in some seminars or in some of the webinars or in some posters. So you can take some parameters and then assess some wound factors and then present it in before and after treatment. So here is the case where I have assessed some itching factor, discharge factor, foul smelling, pain and size of the wound, etc. What is the status before the treatment and after the treatment? So now come to what is an ulcer. So we have seen it through Ayurveda. Now the application part, applying the same thing, and you can understand at the end of the my presentation, you can feel that there is no difference between what is the concept of Vrana in Ayurveda and what is told in the modern. It's just the extension and refining of the factors. So ulcer is a break in the continuity of the covering epithelium or skin or mucous membrane due to the molecular depth of the tissues. So if you consider, say, I will give one example of the picture here. You can see the picture. So there is a wound, a very ugly wound, which is present in the foot. So if you just see the outermost part, what you can see, there are some parts of the ulcer. We'll explain that also. So outermost part, what you can see, periphery, is called as margin of the ulcer. And what you can see, there is little light pale color inside that round spherical area. That is the floor of the ulcer. So now the ulcer is of 2 types, acute and chronic, for easy understanding. And this ulcer can be classified in 2 varieties, clinical and pathological classification. So clinically, we call it as healing ulcer, non-healing ulcer, and callous ulcer. Even in Ayurveda, Acharya has told as a dushta vrana and shuddha vrana. And in specific ulcer, you have already studied in your final year class, like there are some of the specific ulcer which are happening because of the specific cause, like tuberculosis or syphilitic, and non-specific like arterial ulcer, venous ulcer, tropical ulcer, trophic ulcer. So these are the classification of the ulcer. So now come to the examination. This is what I am taking from Sushruta Samhita and just applying according to the modern here. So if you want to do the examination of the ulcer, after taking the detailed history of the patient, when you come to the local examination of the ulcer, you have to do the inspection, palpation, and examination of the other system like arterial, venous, or nerve system. So now, what are all the factors we have to examine in a patient? So Acharya has told you have to examine the Akriti, Varna, Vedana, Srava. This type of the examination has been told. So even in modern science also, when you want to examine an ulcer, you want to exactly depict what is the location of the ulcer, what is the size, what is the shape, how many number of the ulcers are present, what is the edge, floor, base, and margin of the ulcer, whether there is any systemic involvement is there or not. So we'll discuss about that, what has told from the Acharya Sushruta, and now we will try to apply in the modern, so that you can get the exact clue how we can at the bedside, how we can examine. So based on the size and shape of the ulcer, There are some of the ulcers which are typically very large in size, and some of the ulcers are very small in ulcer. And there may be a single ulcer or multiple ulcers may be present. So that you have to, when you are examining, that you have to number and position. Based on the position, even Acharya has told, based on the sthana of the Vrana also, there are different diagnoses you can make. For example, a person who is getting an ulcer at the ball of the fingers, that is extremes. So those patients may be considered as a case of arterial ulcer, or it may be a case of uh, uh, diabetic ulcer. And especially in a case of venous ulcer, the patient will develop the ulcer at the gaiter area, or it is above the malleolus area, either in the medial malleolus or either in the lateral malleolus. So this is the edge of the ulcer. So you can see what is the edge of the ulcer. So edge is the one which is connecting the margin and floor of the ulcer. So now what is floor? Floor is nothing but what we see exactly at the area where we can see, that is the floor of the ulcer, and the outermost periphery is called as margin of the ulcer. So there is a connection between the margin to the floor, that is called as edge of the ulcer. So based on the edge in your exam also, this is a very important Viva question. We have 5 types of the edges: sloping edge, undermined edge, everted edge, punched out edge, and raised edge. So this is what I was talking about, the Vranasrava. There are some Vranasrava Salila Prakasha. Yeah, so if it is a superficial ulcer, so then there will be watery type of the discharge, that is called as serous discharge. And if there is a pus discharge is there, so if it is a infected wound, there will be pus discharge will be there. Or if it is a mixed with the blood and the pus, then it is called as serosanguinous discharge, and the blood discharge usually present in case of a malignant ulcer. So this is the application part of that. And surrounding area, once you finish that, what is the edge, what is the margin, what is the floor, discharge, everything, then you have to see the surrounding area also, whether it is the color change is there, whether then there is any pigmentation is there. Here you can see in the first picture, the blackish discoloration is showing that there is some eczematous changes, there is some stasis of the blood. So that is especially in case of venous ulcer. And second picture, you can see a gross edema and inflammatory sign. And if you see the whole of the limb, sometimes there may be presence of the varicose vein, or sometimes there is a edema, unilateral limb edema may be there in case of deep vein thrombosis. So next you come to the palpation, whether the ulcer is tender or not. So sometimes the Vrana is Vedana Rahita Vrana may be there. So if a ulcer is painless, then you should worry more. If a ulcer is painful, then there is no much of the worry. But if it is a painless ulcer, then you should always check for whether it is a malignant change is there or not. So this is one real scenario where I have taken a picture. You can see the edge of the ulcer is everted in this condition. So if you just clean that and just rub with the gauze piece, then it will start oozing the blood. So that is called as bleeding on touch, which is a the typical feature of a malignant ulceration. So now next you have to examine the vascular insufficiency. So now we come to what are the stages of the Vranas as per Sushruta. So you can classify as Dushta Vrana, Shuddha Vrana, Ruhyamana, and Rudha Vrana. So now what do you mean by Dushta Vrana? Dushta Vrana is nothing but it is you can consider it as an infected wound, or a wound which is present having some discharges. Ati Samvrata, Ati Vivrata, Ati Kathina, Ati Mrudu, Utsanna, Avasanna, Ati Shita, Ati Ushna. So these are all the features of the Dushta Vrana. So for example, I can give some example, like says Ati Samvrata and Ati Vivrata. There are some of the ulcers which are having very narrow edges. So that indicates some deeply situated infection. Or Ati Vivrata, very wide opened wound. Or Ati Kathina and Ati Mrudu. There are some of the granulation tissues developed which may be bleeding on touch. So that is the Ati Mrudu. Ati Kathina, there may be a very severe induration may be present. So these are all says that there is very poor sign of the wound healing may be there. or Sheshaha Kafeno Unmargi Mukha. Sometimes the wound is present and it is flowing deeply inside. And you can see Krishna Rakta Pita Shukladinam Varnanam Anyatama Varnaha Bhairava Darshana. Bhairava Darshana is once you see the picture, I can show some example. See, if you see this picture, Bhairava Darshana, it's very ugly and it feels horrifying effect. So these are all the Dushta Vranas. There are some discharges which are more severely. See, in the second picture, you can see here, the tendon is visible. In the first picture, you can see some blackish discoloration. That is the severely blood supply. When it is hampered, it is called as arterial ulcer. Ischemic change has been happened. So this is one example of the development of gangrenous change after the development of the wound. So right foot is going for the gangrenous change. And the next other lakshanas like Krishna Rakta Pita Shukladinam Varnanam Anyatama Varnaha. So there are some of the color of the wound which are like blackish discolored, like gangrenous changes, or very severely reddish discoloration. All these features are the Dushta Vrana Lakshana. Puti Puya Mamsa Sira Snayu Prabratibi. So in this picture you can see Puti Puya Mamsa Sira. Right. And the Atyartha Vedana one. So there will be severe painful condition may be there. And Dirgha Kalanubandhi. So some of the ulcers which are present since 15 years, 16 years, 10 years. So they are the Dirgha Kalanubandhi Vranas. Dushta Vrana Lingani. So these are all Amanojnya Darshana. It's a horrifying effect when you are seeing. So Nana Gandha Varna Vedana Sahita. So all these are the features of Dushta Vrana. So these are all some of the real-time examples I have taken in my OPD. There are some of the examples. In the first picture, you can see it is not showing any sign of the healing. So these are considered as Dushta Vrana. And if you convert it into Shuddha Vrana, then it is going to heal. And the second picture, you can see some of the tendons are visible. So these are some of the examples. So this is a malignant ulcer. If there is a everted edge is there and bleeding on touch is there, but it is painless, then it is a malignant ulcer. So you have to take a biopsy and send it for histopathological analysis, and it will give the presence of squamous cell carcinoma. So these are some of the ulcers which are having the maggots also present in that. These are the Dushta Vranas. And this is one basal cell carcinoma having if you see the edge of the ulcer, it is called as raised and beaded type of the ulcer, which is typically present at the area of the near to the eyebrow area, and the patient is of more than 50 years. So that is the rodent ulcer or a basal cell carcinoma. So this is the stages of the ulcer. It may be a spreading ulcer, it may be a non-healing ulcer, or it may be a healing ulcer based on the stage of the ulcer. So now come to, after seeing that all ugly pictures, those are all the Dushta Vranas. Now what is the Shuddha Vrana, concept of the Shuddha Vrana? So Jihvatalabo Murdusnigdaha Lakshno Vigata Vedanaha Suvyavastito Nirasravashyate Vranaha Shuddha Ityuchyate. So if you want to say a Vrana is a healing wound or it is a Shuddha Vrana, it should have Jihvatalab. It is like a very red color, and it should have the Jihvatalaba. It is like the red tongue-like, and Mrudu and Snigdha, and it is slimy in nature, and the pain has been reduced, and Suvyavastita. The edges are very marked and they are not irregular, Suvyavastita, and Nirasrava. The discharge has been reduced. So this is the Lakshana of Shuddha Vrana. And once it is in the stage of the healing, it has started showing the signs of the healing. Kapota Vrana Pratima. So there is a grayish color at the edge of the ulcer. Asya Antaha Kleda Varjitaha. The kleda, the discharge has been reduced. And Stirascha Pitika Vanto. It shows some granulation tissues. Pitika is the sprouting granulations are present, so that should be considered as a Ruhya Manavrana. And once it has completely healed, Ruda Vartmanam Agranti Ashunam Arujam Vranam. So the pain has been completely reduced and the swelling has been reduced. The wound has come to the surface level, it has come to the skin level. Twak Savarnam, the color also almost to the skin color. So then it has to be considered as a healing wound. So now the extended version. If I tell only the diagnosis of the ulcer, then it is not sufficient. So if you want to apply that, then we come to the Vrana Chikitsa, but the topic is very vast. So there are 60 procedures within this time schedule. I can't finish all the 60 procedures. I'll just give how we can apply some treatment aspect when after considering this diagnosis part. So if you want to treat a case of the Vrana, there are 60 procedures has been told, but we can apply some other concepts here and then treat according to that. So I consider if I want to treat the Vrana in the stage of abscess stage, then Vrana Shofa Chikitsa can be taken, inflammatory stage. If it has converted into an abscess, then Vidradi Chikitsa can be adopted. And once it is fully formed Vrana, then 60 procedures of the Vrana can be taken. Even in the Vrana also, you can take the Dushta Vrana Chikitsa, you can take the Shuddha Vrana Chikitsa, you can take the Sadhya Vrana Chikitsa, you can take the Nadi Vrana Chikitsa also. So now, what are the Shashti Upakramas? I'll just name those: Apatarpana, Alepa, Parisheka, Abhyanga, Sweda, Vimlapana, Upanaha, Pachana, Visrana. It goes like this. So there are Ekadash Upakramas has been told, and then Ashtavida Shastra Karmas, Chedanadi, Ashtavida Shastra Karmas has been told, and there are some of the Shonita Sthapana, Nirvapana, then Kalka, Sarpi, Taila, Rasakriya, Avachurana. These are some of the special treatment, and some of the cosmetic treatment has been told. If you nowadays the cosmetic branch is very much what it is expanding, but the basic concept you can take from here itself: Mrudu Karma and Daruna Karma, Pandu Karma and Krishna Karma. If you want to change the color of that area, if you want to increase the pigmentation, so then you can use the Krishna Karma. If you reduce the pigmentation, then Pandu Karma you can use. So such treatment: Roma Sanjana and Loma Apaharana. If you want to remove the hair from a particular area of the wound, so Acharya is explaining about the Loma Apaharana and Roma Sanjana. All these things has been explained. Then once you want to treat a case, you can take the Amavastha, Pachyamanavastha, and Pakvavastha. So these are the three avasthas has been told in the Vrana Shofa Chikitsa. So that can be applied. If the Vrana is in the Amavastha, then the treatment is different. If it is in the Pakvavastha, then the treatment can be different. So these are some ideas I'm giving how you can go ahead along with the treatment. It's not only like you directly go to clean the wound just with betadine, then apply some, clean it with the hydrogen peroxide, then betadine, some antibiotic. It's not like that. Acharya has given wide range of treatment aspect. So even the Kriya Kalas, based on the Kriya Kala also, you can modify the treatment. So in nutshell, what are the different treatment we can adopt? So Saptopakrama, Ashtavida Shastra Karmas, like Chedana, Bedana. If you want to scrape something, then you can use the Lekhana Karma. If you want to clean the wound, we call it as Vrana Shodhana. If you want to improve the healing aspect, then you can use the Vrana Ropana concept. And if you want to use Kashaya, that can be internally or externally can be applied, or Varti can be inserted in a very Sukshma Pradesha. If a Vrana is there or Nadi Vrana is there, you are not able to treat it just with the medication. So then medicated Varti, a gauze piece which is dipped in Ghrita or Taila, and that can be inserted at that Nadi Vrana area. Or Sarpi, Taila, Rasakriya, Avachurna. These are the special concepts of the Sushruta Samhita where you can apply Rasakriya also in treating the Vrana. And Vrana Lepana, Bandha Vidyadhyaya is one of the core concepts of Sushruta Samhita, where he is explaining about the Lepa, application of the Lepa and the bandaging. Again, if you want to see the bandaging, there are 14 types of the bandages are there that can be applied in different type of the Vranas and according to the different areas. So if there is a open wound is there, then you have to use the Sivana Karma. And if there is a wound which is not showing the sign of the healing or which is having some discharge, then you can use the Vrana Bandhana also. So some examples, see Vamana. So Panchakarma, in the Panchakarma we have Vamana. If you want to use the Vamana in a case of Vrana, how we can apply that? So Utsanna Mamsa Shofa. So if there is a elevated lesion of the wound is there, and it is especially a Kafaja type of the Vrana, then you can use the Vamana Chikitsa. So then locally you can treat it, then you get a very good result. And Dirgha Kalanubandhi and Vata Pitta type of the Vrana is present. So if there is a ulcer is there at the foot area, say for example, I have treated a case of this venous ulcer, which was not healing at all. So then it was the ulcer was present since 18 years. It is not showing the exact signs of the healing. Then I consider it as a Vata Pittaja Vrana and Dirgha Kalanubandhi. Then Sadhyo Virechana and a classical Virechana has been utilized. Once the classical Virechana is given and then the local treatment and the internal medication is given, patient is responding very well. So that is what Acharya is telling. Dirgha Kalanubandhi Vrana, if it is present, your local treatment is not at all enough. You have to treat it with Virechana Chikitsa. So apakeshu tu rogeshu katineshu stireshu cha snayupothadishu tatha chedanam praptamuchyate. So this is the chedana karma indication told in Sushruta Chikitsa Sthana. If there is a apaka is there, so Vrana which is not showing a paka and katina and stira, it's like swelling is present, lipoma is present, then in such condition you use the treatment like Chedana Karma is nothing but the excision. Bedan is Antapuyeshu Avaktreshu Tathaiva Utsangvatsvapi. So Vrana is there, but inside, or abscess is there, but inside pus is there. Until and unless you remove that pus, Antapuya, you want to, if you remove the pus, then only the wound will be going to heal. And Lekanakaram, Katina Utsanna Mamsa. When there is Katina Utsanna Mamsa is there, you do the scraping action. And Yeshana, in case of Nadi Vrana, in case of Shalya Vrana, we will be doing the probing. And the Ugra Ruja condition, the Lepa has been told. If there is a severe pain is present, then Lepa is going to help. And Shodhana Kashaya, if there is a Durgandha, Kleda, and Pichila Vrana. I will give some practical clinical example with the picture, then you can understand how you can use the Shodhana Kashaya. So if there is a discharge is there, if there is a foul smelling of the wound is there, then you can use the Shodhana Kashaya for cleaning the wound area. So it's not like you have to treat it only at the local area, but you have to consider the whole patient also. That's what Ayurveda is saying when we are treating the patient. Cause should be found and treated first. But if the patient is having some other wound factors, like if the patient is suffering with the anemia, if he is suffering with the multivitamin deficiency, if he is suffering the protein deficiency, then also the wound is not showing some of the healing factors. Then you should correct that. If there is a blood deficiency is there, then you have to transfuse the blood. And controlling the pain and infection is very, very important. And in some of the Vrana's wound area, we have to give the rest, immobilization. And if it is a venous ulcer, the elevation itself will give some result to the patient, and avoidance of the repeated trauma. For example, if a person is having the dental ulcer, oral ulcer, and the sharp teeth is repeatedly irritating that area, then that Vrana is not going to heal. Then you have to remove the teeth. Then avoidance of the repeated trauma will be addressed. So care of the ulcer by debridement. Sometimes in the previous picture what I have shown, all this fluff, the unwanted material is there. Until and unless you remove that unwanted tissue, the wound is not going to heal. Then you do the Vrana Shodhana, Vrana Ropana. So the Chikitsa, in my practice, what I adopt is Agni Deepana, Amapachana, Sroto Shodhana, then Anulomana, Avaranagna Chikitsa. Sometimes there is a Avarana is there, some blockage is there, there are some clots are there. Until and unless you remove that, the blood circulation is not going to happen properly at that area. So there is the Avaranagna Chikitsa and Kafavatahara Chikitsa, and sometimes Avasthanusara Chikitsa. If it is Amavastha, the treatment is different. If it is a Pakvavastha, the treatment is different. And you can adopt the Shashti Upakrama, the indication also told in Sushruta Samhita. All those can be applied according to the Avastha. So mainly we treat it with you can adopt the treatment like Amapachana, then Vata Anulomana, so that the Vata will be kept in the right direction, and Amapachana will reduce the inflammation, and Bahya Chikitsa will help to reduce the muscle spasm and increase the blood flow to that. And the pain reduction is also very important, that we are treating with the internal medication, and those internal medication will reduce the oxidative stress. So we'll come to the some of the sample case studies I'll show here. So this was a patient who had unilateral limb swelling, pain, and ulceration developed in his foot. And on examination, if we have treated him without the investigation, we would be mostly landed in trouble. But you can see there is a avarana, the thrombosis is present. So this is one more condition, different presentation of the Vrana itself. We can take it as a kushta also. Kushta chikitsa can be adopted. A case of varicose eczema and long-standing varicose vein is exhibiting in the form of eczema, and then Vrana has been happened. So this is a clear condition of Siraja Granthi or a varicose vein, and it can be treated with the Jalavkavacharana. So in this patient, I have treated with the oral medication and the few sittings of the Jalavkavacharana, which has given a wonderful result. So this is also a Vrana, a case of venous ulcer or a varicose ulcer, a Vata Kaphaja Vrana, and at that stage, patient had developed severe pain, burning sensation. So as Jalavka is Pitta, it can be utilized in Pittaja Vrana also. So in this patient, we have got very good result with the help of Jalavkavacharana. So this is what I was telling about the feature of a Sabdyo Vrana. If you get the sloping edge, so then that wound can be considered as a type of the healing ulcer or a Sabdyo Vrana. This is one more Vrana which was treated with the Jalavkavacharana and Lekhana Karma. So this was one more patient. Wonderfully, I got the result in this condition after applying some of the our parasurgical procedure. So initially, the patient had the wound which was present since 10 years, and that wound used to reduce, and once again it sprouts open and increases with the pain and discharge and swelling also. So here we have treated with the Panchavalkala Kashaya Dhara, then Matra Basti, and Manjishtadik Shara Basti, and Avastika Chikitsa like Siravyada. So you can see in this picture the same patient. Before the treatment in bilateral foot, the color was different, there was a pigmentation was there, the ulceration was present, and that was a Vata Kaphaja Vrana, and that has been after the treatment, the wound has been completely healed. So this is one more case. Why I am showing is just with the few days of the Ayurvedic management, the timely adoption of some of the chikitsas, external treatment, and the internal medication is going to give a wonderful result. So here also, after the treatment, you can see the wound has been healed completely. So here this Siravyada has been done in this patient, and these are some of the examples we usually do in our hospital, the Kashaya Dhara, or you can take the fistula case or sinus also, Ksharasutra treatment, and the wound dressing. And this is one of the case where the severe pain has been reduced with the help of Siravyada, in a case of Vrana, in a case of disc lesion also. So this is one of the innovative where we are trying to use tulle. We call it as a medicated dressing, which is applied with some Aushadha Yoga, and then applied, that bandage is applied over the wound. So these are some of the Aushadha Yogas which can be used in a case of Vrana, internal medication like Gandhaka Rasayana, then Laghusuta Shekaravati, Arogyavardhini Rasa, Guggulu Panchapala Churna, Manjishtadi Kashaya or Asanadi Kashaya or Dashamula Kashaya, Kadirarishta, Sarivadhyasava, Ushirasava, or in the Guggulu like Kaishwara Guggulu, Amritadi Guggulu or Triphala Guggulu. And the Shodhana like Vamana or Virechana, and even in the Virechana also it can be Ruksha Virechana or Snigdha Virechana depending on the avastha of the condition. And Basti like Manjishta Dikshara Basti, there was a research carried where Manjishta Dikshara Basti is going to give a very wonderful result in the atherosclerotic patients and even in the venous pathology conditions. And Dashamula Ksharabasti and Vrana Shodhana like Trifala Kashaya Dhamana or Panchabalkala and Arakbadadi Kashaya. It is not like you have to use all the medication. See, for example, if the patient is having more Pitta Pradhana Vrana, you can use Panchabalkala Kashaya for Parisheka. If the condition is more of the Kapha Pradhana, more of the Snigdha, Gurutva, and more of the Kapha Pradhana Lakshanas are there, you can use Aragbadadi Kashaya. Or if it is a Vataja condition, you can use Dashamula Kashaya if it's a more of the painful condition. Or commonly you can use the Trifala Kashaya also. Even in the similar way, for Vrana Ropana, for wound healing also, we can use Jatyadi Kaila, Madhyashthyadi, or Shatadauta Grita based on the avastha of the patient. So these are the some of the Patyas. So I hope if I'm extending it, it may be much more boring. So I'll end up here. So thank you for the wonderful opportunity. Thank you, sir.
Thank you, sir. On behalf of this organizing team, it's my privilege to thank you all for this today's online session. First and foremost, I extend my heartfelt gratitude to our guest speaker.
Puja, question answers.
Oh, sorry, sir. Like question and answers will be conducted now. Whoever has the questions, they can raise the hand by clicking the reactions from the below icons.
Okay, anyone who has the question can click react icon and press hand raise. They'll be unmuted and they can ask the question thereafter. Mallikarjun. Mallikarjun, you can unmute and speak. Second is Shrestha Raj. I have allowed you both to speak. You can unmute yourself and speak. Okay, Mallikarjun has dropped a message. He is unable to unmute himself. Oh, here I have enabled him. I don't know what is the issue.
I think they can write the question, sir.
Yes.
In the chat box also. That's so fine.
The chat box can be used. Oh, they are finding it difficult. I think from my end, I have enabled the chat. Okay, I'll ask the question that has come in my WhatsApp. You can reply it. I want some more information about the medicated cotton gauze used in this practice.
Yes. Yes, it is a right question. So usually nowadays there are some thesis works are going on with the medicated ghees or medicaments which are applied over a thin surface of the gauze piece, like for example St. Madhugrata or Jatyadigrata, or nowadays some of the kashayas they are converted into nanoparticle formation and then they are applied over the bandages and then they are tried. It's like similar to the modern. There are some of the ready available cotton bandages are there. So similar way in Ayurveda also we can prepare our own bandages.
Okay. There is another question. Can you tell when to use Jaloka and Rakta Mokshana to treat the Vrana?
Yes. See, what I used to do is a patient who is having a varicose vein. So first identifying the cause of the Vrana is very important. So if the Vrana is happened because of the Siraja Granthi, so there is the Raktavaha Srotas is affected, and in Siraja Granthi, varicose vein, the Rakta Mokshana itself is the treatment. So one of the modality of the Rakta Mokshana is Jalokavachana. So if the patient is not willing for Siravyada, you want to prick a needle, then if he is not ready for that, then you use Jalokavachana. But if the patient is ready and Sarodayika Rakta Dushana is there, then you can use the Siravyada.
Raksha Naik. Okay, I think there are no more questions. We have come to the end of this session. In fact, very a nice session where Dr. Shankar, who is a very versatile student of Ayurveda, where Ayurveda runs in his families, shared his experiences. There is another question. What is the management for malignant ulcer?
Sorry.
Yes.
Our aim is first diagnosis of the condition. So diagnosis is based on you can diagnose the malignant based on the histopathological analysis of the ulcer. So if it is found to be the malignant, and what type of the malignancy is very important, whether it is in which stage it is there, what type of the cell is there, whether it is a squamous cell carcinoma, whether it is a basal cell carcinoma, whether it comes under our purview or not. So rather than, I'm not expert in treating the malignant ulcer. I have not treated much of the cases. Usually if I diagnose, I will do up to the diagnosis part and then refer that patient to the where the treatment of that cancerous treatment will be done.
Okay. Pooja?
Yes, sir. Can I continue, sir?
Yes, yes.
Okay, sir. On behalf of the organizing team, it is my privilege to thank you all for this today's online session. First and foremost, I extend my heartfelt gratitude to our guest speaker, Dr. Shankar Prasad sir, for sharing such a valuable insights. Thank you, sir.
Thank you.
A sincere thank you for Dr. Anand Katti sir for constant support and encouragement. Thank you, sir. A big thank you for Vishwa Ayurveda Parishad for organizing this enlightening session. I thank for all the participants for making this event successful. So thank you all. Now I request Vasundhara to chant the Shanti Mantra.
ॐ सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति शान्ति शान्तिः
Thank you, sir.
Thank you.